I'd like to bring in Nancy Cardenas-Peña. She's the Texas State Director for Policy and Advocacy at the National Latina Institute for Reproductive Justice. And Dr. Durrani is an emergency medical physician. Thank you both so much for taking the time to speak today. Nancy, I'd like to start with you. Your reaction, first of all, to that leaked draft opinion.
I mean, I think we can pretty much say, even doing this work for such a long time, the leak was a gut punch. You know, it was a dark moment for folks who are doing this work. And that's not to say that, you know, we understand and we've been under a lot of restrictions that already exist, even though Roe v. Wade was legal, but it was still pretty impactful and resonated within our communities.
Now, Waze, as a doctor, you have to advise people who need help. What changes are you expecting if this ruling comes down as expected?
Yeah, absolutely. Unfortunately, in Texas, we've had a preview or a mini preview of what's about to come for a lot of other states around the country. And that's the Heartbeat Act bill that you mentioned that essentially bans abortions past 6 weeks. You know, a lot of people come to the emergency department, and for a handful of folks, I'm the first one to tell them that they're pregnant. And in a lot of cases, that's fun news, that's good news, it's a celebratory mood. But some patients will ask me what options they have. And if they're past 6 weeks, the unfortunate truth is they might not have a lot of options. And me simply, you know, even guiding them to resources, whether that's an OB or other community resources, could open myself up to litigation and being sued for up to $100,000. And the fact that I even have to think about that when I should only be thinking about a patient's health is ridiculous.
I want to ask you, what will this ruling mean for people training to give abortions? I mean, doctors could also face life in prison if they disobey this law. Can you provide the services that people need?
Well, that's a great question. Look, when we are in medical school and say you want to become an OB, you go to residency. You want to go to the most grueling of programs, the programs that's going to give you hundreds and thousands of procedures. So what if you practice in a state where abortions are banned? You're not going to get that experience. And then when one day you have to perform an abortion as a life-saving measure, or you work in a state where it's legal and you have to perform one, you may not be giving the best care to that patient. And so even our medical education training system is something that's going to be affected by this, and a lot of uncertainty around that.
Now, Nancy, we touched on the fact that last year Texas passed a restricted 6-week abortion ban. That's forced many to seek treatment out of state. Now, this could be a look at what's to come in many other places. Can you tell us what the obstacles are facing people who do have to travel to access abortion?
I mean, I think abortions are already an expensive enough procedure, but I really want to note that a lot of people cannot travel for their abortion procedures. It's already a costly process. Traveling, childcare, making sure that transportation is available. But we work in communities where folks who are undocumented can't get across internal immigration checkpoints. And so whatever healthcare that the state of Texas offers is what people are subject to. So those conversations around traveling out of state when people deserve healthcare in their own cities is a lot more complicated than just that.
And can you tell us a bit more specifically about how people of color are affected by these laws?
We live in areas without the support of mass transit. So whenever we take into account abortion appointments, we have to take into account transportation, childcare. Often the conversations that we're having with people is, do I go to my healthcare appointment, or do I pay for my utility bill, or do I go to my healthcare appointment and be in risk of being placed in deportation proceedings and separated from my family? And these are long conversations that we've been having in communities like this, even with Roe v. Wade present.
Right, so travel doesn't seem realistic there. So the WHO says unsafe abortion is a leading cause of maternal deaths. Can you tell us why it's so important to have access to trained professionals?
Yeah, absolutely. You know, it's a saying that we've been saying a lot. Banning abortions will ban safe abortions, not unsafe abortions. And we've all heard these stories of patients, you know, being taken to extreme lengths and taking extreme measures previous to Roe v. Wade, and, you know, ending up in life-threatening situations. You know, one point I'll make is we talk about abortion as a choice. For a lot of I had a patient a couple weeks ago that had pulmonary fibrosis. For that patient, their lungs were weak, they were pregnant. For them, being pregnant was a life-threatening condition. And the fact that in some states that might be banned under this, and the fact that that might be harmful to that patient is unthinkable to me as a medical provider. And as I mentioned, you need a lot of training to be able to perform safe abortions. The fact that we might have some physicians and some providers that might not get that training because of this, because they won't see those patients and then won't be equipped to take care of those patients when they see them in the future, is once again unthinkable.
And have you or your colleagues treated patients who have sought out illegal, unsafe abortions?
Yeah, so I'm an emergency medicine provider. What I do is if a patient would like to go down that route, I refer them to an OB, whether that's in our hospital or out in the community. As I mentioned, it's something that's become more difficult because providers are scared that they are going to get sued by essentially anyone, and that's how that Texas bill is written. And if this decision and ruling comes down, we are expecting abortions to be completely banned. So it's going to be even more difficult to get them those resources in a timely manner, in a manner that's safe for them.
And Nancy, from your experience living and working in Texas, what do you think the biggest concerns should be for people in the rest of the country as we await the final ruling on this?
I mean, I think people need to understand that what happened was a draft ruling and not something official. Oftentimes when things like this happen, it creates a chilling effect in our communities where people may not get the care that they need, but people can absolutely still get that care. And so come June, whenever we receive this official decision, of course, things are going to get a lot more complicated. And these are conversations that we're having within our community, right? The point of SB 8, the point of SB 4 is not only to criminalize a very safe and basic medical procedure, but it's also to create that chilling effect and make us afraid to do this work. And that's not something that's going to stop.
Right. We heard the head of Planned Parenthood there saying that abortion is still legal, telling people essentially not to cancel their appointments. Have you seen that in your own community already, that this has had that chilling effect?
You know, every single time we see things like this happen, you know, instead of the state intervening and offering clarification, it's up to us to provide that education, that information, and those resources. So I have been getting a lot of questions about what this means, what this entails. Is abortion legal or not? Can I seek an abortion procedure right now? And we often have these conversations with community members in both English and Spanish to fill in the gaps that the state often causes whenever things like this happen.
I'm afraid that's all we have for time today, but I want to thank you both so much for coming onto the show and sharing your insights with us. That's Nancy Cardenas-Peña, the Texas State Director for Policy and Advocacy at the National Latina Institute for Reproductive Justice, and Durrani, an emergency medical physician. Thank you both so much for your time.